as a health advocate, and as someone who felt that we needed to do something also to help our government fight this disease. And so I'm here talking to you about testing. Is it necessary? Is it reliable? And what should we do to avoid getting sick with COVID? Just give me time to do a share of my screen for the slides, okay? Let me see. There we go. Can you see my slides now? Bambina, can you see my slides? Can you see the slides now? Okay.
No.
Yes? No?
I don't see it. No. Sorry, guys.
Okay, wait. Screen share. Okay, let's do this again. I'm sorry, wait. Screen share.
Oh, there you go. It's coming out.
There's okay. It's there.
Yeah.
Okay, great. Okay, good afternoon. So we're going to talk about testing. Are coronavirus tests reliable and necessary? Okay, just some quick stats on the COVID pandemic. No, as of today, the world, we have 3,646,834 infected, 252,222 deaths. Recovered is over 1 million. That should be 1.2 million. In the Philippines, as of I think the last update they gave, they said there were 9,485 infected, 623 deaths, and 1,315 recovered. Now, the thing about COVID-19 is that 70 to 80% are actually asymptomatic or mildly symptomatic. And this is what makes it a little bit tricky, because these asymptomatics and mildly symptomatics can actually infect others without them knowing that these people walking around actually have it. And it is quite infectious. No? It's easily spread. One person can infect about 3, and the 3 can infect another 3, and it really spreads very fast. Based on the common signs and symptoms, that we have fever, dry cough, headache, body weakness, body pain. Many complain of a lost or diminished sense of smell, loss of taste, confusion, diarrhea, conjunctivitis. Yes, it can appear as conjunctivitis. Now, I got this from Science, no? The journal Science, April 24. It says an invader's impact. We thought COVID just caused pneumonia, or else in the mild cases, just some fever. But then we're seeing that it can really affect so many parts of the body. We have the lungs when we have the pneumonia. We have the heart and blood vessels, actually, no? Where they can cause the heart muscles to weaken. They can cause heart attacks, no? And cardiac inflammation, as I said. So they're seeing a lot of heart attacks and blood clots. It can also affect the brain. And sometimes people complain of confusion and then inflammation of the brain. And we're still trying to understand exactly how it causes, the virus causes brain damage. It can affect the eyes, as in conjunctivitis, inflammation of the membranes, no? Which is like sore eyes, no? Except that it's caused by the COVID coronavirus, SARS-CoV-2. And studies have shown that sometimes, even when the virus is no longer isolated in the nose or the throat, it can still be found in the eyes, in the conjunctiva, and it's still viable. Of course, it's found in the nose. Then also the liver, okay? It can cause liver damage, it can cause kidney damage, and once it causes kidney damage, these are the ones who usually talaga die, no? Then it can also affect the intestines to cause diarrhea. These are places where there are many receptors to the virus. I want to stress, this is a broad strokes lecture. I'm not going to give a medical lecture because this is not for doctors. But I wanted you to know that it's really an invader. It can affect a lot of the organs of the body, not just the lungs. Bambina, can you see me or just my slides?
Yeah.
Do you see me also? Okay.
No, only me. I can only see you.
Oh, okay, the slides. Okay, I thought. Okay, so it's an invader. Okay, and so while the symptoms can, and it's very interesting because the symptoms can range from virtually no symptoms to severe symptoms and death. Okay, so it's a very unusual sort of virus. No? Now, Okay, I want to start with this. Imagine we were living in an ideal world where the Philippines responded to the coronavirus pandemic the way Taiwan did. Because Taiwan was one of the best that responded, and they responded early. So I'd like to show you an ideal world. As early as January 2020, we could have done the following. One is we could have beefed up our RT-PCR testing capacity. That's the swab test. We could have done that. We could have conducted an inventory of the ICU beds, the ventilators, the PPEs, trained our ICU staff, healthcare personnel available to man hospitals, and made sure that we already started to stock up on the PPEs. That's what we did in PGH. When we were told we're going to become a COVID center, we really stocked up like mice and squirrels on PPEs. We could have done that. We should have done that starting January. We could have stopped the entry of persons from China as soon as the Wuhan lockdown was put in place. We should have done vigorous contact tracing of the contacts of the Chinese tourists, one of which who died, who tested positive, and tested all of them as early as January. But unfortunately, we did not do testing because we only had 2,000 kits. And we could have sounded the bugle early, the bugle call early enough as soon as suspected COVID patients were being admitted to the ICU of the Philippine Lung Center in February, as well as other suspected COVIDs already early on. This would have been ideal, but this is wala na, we cannot go back to what was. So what happens? No? On the left side, the ideal situation. If we had done the ideal, we would have had rapid RT-PCR tests, the swab tests. No? Almost everyone, for everyone, from that time, the first few COVID-like patients were in the heart center, our lung center rather, and other hospitals. And we could have had these results very quickly, maybe 4 to 8 hours, at most one day. Then we could have properly quarantined and treated all of those who were tested positive. And of course, practice physical distancing, cleanliness, masks, and there would be no need for a lockdown. But the reality is on the right. We only had 2,000 RT-PCR test kits until very late in the game. We had to keep sending our tests to Australia, in fact, for a long time. Our testing capacity as of May 4, 2020 is only 5,000 a day. And our target is to have 30,000 a day, hopefully by the end of May. And this is with the help of the private sector. The turnaround time for RT-PCR test results is still 5 to 7 days. This is the truth. And there was the other day, a friend of mine from the National Kidney Transplant Center said, Minguita, we got our test result today, but we've swabbed it April 17. So what we're really seeing now as to the cases per day are not necessarily today, because some of those results were swabbed a week before or even longer. So we should date them so we actually see the curve. And so we have a backlog of at least 8,000 as a result. As of May 2, Lung Center closed. They had a backlog of 4,000 because they were running out of some reagents. So it's not a very ideal situation. It's reality. Physical distancing, cleanliness, masks, yes. But because of this, we needed to do a lockdown. It was necessary. This was the only way, and we have. The lockdown was necessary, otherwise we would have had an exponential growth of infections. The prediction in March was about at least 75,000 infections. That was the prediction. No? I'm not even sure if we really have that because we haven't really tested. But the lockdown was necessary, and the lockdown appears to have worked. How come? Remember early on, you had news about hospitals bursting at the seams. We had our ICUs were overwhelmed, our emergency rooms were overwhelmed, no? And we had to close so many other departments and other services just to accommodate the COVID patients. Well, the good news is that, like St. Luke's, where I am connected, no? It's no longer bursting at the seams. No? We used to have 2 ICU units devoted to COVID patients. Now it's down to 1. We used to have 3 floors devoted to COVID patients. Now it's down to 1. And the emergency room no longer needs reinforcements from non-emergency room staff. Before, all departments, including ophthalmology, had to go on rotation, no? To triage for ER to reinforce the staff because this is really ganun kadami. Same thing is happening with Medical City. So just while doing a survey of the different hospitals, it appears it's really worked, the lockdown. However, in some government hospitals, it's still kind of bad. So we still need data on that. But it appears, even somebody, my classmate John Wong just spoke today, he said that the curve has flattened, which is good. And this is because of the lockdown. And because the curve has flattened, we can start thinking about coming out of the expanded quarantine to general quarantine. Another reason or another way we found that the curve has sort of flattened is we did rapid antibody testing in 2 districts of Manila, which have one of the most cases of COVID, no, in Manila. One was in Sampaloc, and this is like talagang in the community, no? Sampaloc and Tondo. So April 24, 25 was in Sampaloc. May 3rd was in Tondo. And this is the example. This is a really great project of ours with Mayor Isko Moreno, and I really have to commend them for doing this so well. No? So you would think that there will be so many people with COVID-19 because the situation there is that people are packed in small houses, diba? They live very close together. But this is what we found, and we were happy. This is the Sampaloc results. We don't have these are just partial. We don't have the Tondo yet because they're still analyzing. No? Before we did our tests, Sampaloc had 40 confirmed COVID cases in a population of about 395,000. So that's not bad. If they didn't have a lockdown, siguro that would have been really, really high. No? Then when we tested out of these people, we chose who to test. And I will show you later, who do you test? No? We tested 854 persons. You don't test everybody, you target who you test. No? In 2 days, we found 3% suspect, 3% recovered, and 94% were fine. So they didn't seem to have ever been infected. So that's good. That means the lockdown has worked. And we're not seeing all these infected people running around because they practice social and physical distancing. But the nice thing that Mayor Isko Moreno said is that essential businesses in the district of Sampaloc were able to successfully resume operations after the hard lockdown due to the city government's rapid testing, which enabled officials to immediately know who needed to be isolated or treated and who would be able to go back to work. That was yesterday's Inquirer. And that's very heartening. And the people felt better. Of course, as I will show you later, rapid antibody tests, and depending on the kind that you get, depending on the quality, they're not all the same. No? There's still a small degree of false negatives, and we have to address that. But there's no perfect test. Even the PCR tests have a risk of negatives, and I will explain later the difference between the two, okay? Now, is testing important? The answer is yes. Is it necessary for everyone at this point in time to get tested? The answer is, it would be nice, but it's not necessary, especially for those who have been in quarantine for the last 2 months and you have remained asymptomatic. It is quite unlikely you have been infected, okay? Because you've stayed indoors. There's no way the virus will get to you. The virus cannot survive unless it's inside the host, okay? It will only survive for a few hours, at most a couple of days, but it will just die. So it needs a host, like a person, in order to live. So since we've been distanced from each other, the virus cannot, find next other hosts. It will eventually just die, okay? That's why we have less infections than would have been if we did not do our quarantine. Who should be tested and what test should you use? And I say it depends, okay? Okay, these are the 2 tests that we are using now popularly. No? There are other tests, but they're not readily available. On the left is the RT-PCR, okay? Reverse transcriptase polymerase chain reaction, in short, RT-PCR. On the right, it's a rapid antibody testing. Okay, the left identifies the virus itself. Let's go first to the left. It's how do you get the specimen, either through a throat or nasal swab. No? And then some studies are saying now saliva might even be a better specimen, but we are still using the swabs, nasal or throat. Parts of the virus are captured in the swab, placed in a transport medium, and it has to be in ice, brought to the laboratory, analyzed by a machine, and converted. The RNA of the virus is converted to DNA by reverse transcriptase. Then the machine amplifies or multiplies the DNA to make millions of copies so that this can be read by the machine. The best case scenarios, the results are out in hours, less than 24 hours. The worst case scenarios, as is still happening now, it takes days to get the results, okay? Hopefully this will be over soon if we get more machines, more reagents. On the right is the antibody, the rapid antibody testing. It identifies the antibodies that are produced by the body in response to the virus. These are the soldiers of the body. When you get infected with a bacteria or virus, antibodies are produced, no? And we use blood or serum. What we have now readily available are discs, I will show you later, that can show you through lateral flow chromatography if you have the antibodies or not. It's similar to a pregnancy test, except you use blood or serum and not urine. Results are available in 10 to 15 minutes. So you can actually see it happening and you can wait for it. No? So it's quicker. Those are the main differences. Now, this is the, I'll just, okay. This is the diagram of the RT-PCR, okay? And while I'm doing that, I will, okay. So the swab is sent now to the laboratory, and the RNA is purified and converted to DNA, and it is amplified and eventually read, okay, by the machine. However, this is the problem. The virus in the nose may disappear after 7 days. Either your body successfully gets rid of it after 7 days, and you might still have some of the symptoms, but you're just fighting it. Or if you're malas, it'll go down to your bronchioles or to your lungs. No? So there's a limit, there's a time frame by which you can get the virus, okay? Another thing is that sometimes when you swab, you don't actually get the virus. Sometimes you miss, okay? That's why there's a lot of human error that can happen, and also in the transport to the laboratory. Those are the possible problems. And also, this is a problem. Once you bring it to the laboratory, it should be read soon, either hours or maybe 1 to 2 days. But if you wait 7 days, then your results may no longer be very reliable. So these are the realities on the ground. Now, on the right side naman is the PCR testing, no? Just don't mind the noise, no? And then, can you still hear me? Can you still hear me? Or is it bothering you?
It's not valid.
Bambina? Bambina, can you hear me pa rin? Can you still hear me? Okay.
The government purchased.
So you put in blood, you put a couple of drops of blood in this well, and then you put a buffer in this well, and then you wait for it, you wait for the fluid to go up. Okay? Let me try to I'll try to mute it, okay.
While you're playing, there's a
Okay.
speaker beside.
Yeah. Okay, better. Okay. So now what you see here is this, no? So you notice little by little as the fluid is going up, this line here is appearing, the G line, no? That's immunoglobulin G. You see, kanina wala yan, no? Gradually, it's getting brighter. That means this particular person who had the test, she had symptoms. She was exposed to a person who was actually COVID positive in March 8th. She developed symptoms around a week after, or 5 days, 6 days after. She and her husband naman got hawa to her, no? And then her symptoms were fever. She could not smell so well. She could not taste so well. She had a cough, and she's already in her 70s, so she was very afraid, no? But she never had the PCR testing because her symptoms were too mild to warrant PCR testing, because they were still saving it for people who really needed the testing, no? Those who had to go to the hospital. So she quarantined at home with her husband. And eventually, And so she came to the house April, I think, towards the end of April, and she asked me if I could do the antibody test on her. And sure enough, the results showed IgG. What does this mean? There are two lines. One is there's an M, there's a G. Those who haven't used this test, and the C. C is control. It starts out as a blue line, and for your test to be valid, it should turn red. And then if you don't have this is the M line. If you had the line here, and you had no line in the G, it means you have active disease. And I'll show you later, no, when the antibodies come out. Now, this is an IgG positive person, but no more IgM. This is what I would like to be, because it means she had a disease and she has recovered. And these people with the IgG, I refer them to PGH because they can be analyzed, because they can possibly donate their blood for convalescent plasma therapy. This is where people who recovered can donate their antibodies to people who are still sick. And some of them have actually done that, okay? So this is IgG. So this is a very nice kit. It's a HealGen kit. No? Unfortunately, the Americans are using them all up. It's hard, we cannot buy them anymore. No? Okay. Now, what are the advantages and disadvantages? The advantages of the RT-PCR is that if the virus is captured in the swab, it is virtually 100% accurate. Okay? It can detect the virus even 2 days before you develop symptoms. As soon as it's there, 2 to 3 days, the virus is there, you swab them even without symptoms so you can get it early. So this is one of the main advantages. The disadvantages are many things can go wrong along the way, from swabbing, transport in the eyes, to extracting and reading. And the length of time before it's read in the Philippines is also a problem, because to have accurate results, you should read it soon. Ideally within hours of receiving it, or at least 1 or 2 days. But 7 days, 2 weeks, I don't think you can even, there's a degradation of the virus, and you don't get really good results. This is the reality. You know? And it can miss also the virus in 1/3 of cases, even in symptomatics, because of all the factors that go into it. It requires more skilled and accredited laboratories, and you can have false positives and recovered persons. Remember, see, Senator Angara said he tested positive again after being negative, no? Because the PCR, if it can detect even the dead viruses, the particles of dead viruses, the fragments can still be read as positive. And this is what happened in Korea. They thought there was a recurrence, when in fact, sabi na ng Korea ngayon, it was recently featured pa nga in Inquirer, that it was false alarms, because they were detecting the viruses that are the remnants or the particles which were no longer viable, no longer alive, okay? So that's one of the disadvantages. In fact, for recovery, you're better off using the immunoglobulins, because the IgG, once you see it, it is a sign of recovery. And as long as your test kit is actually sensitive and specific. It's not the bad kind, but the fairly good kind. Now, antibody tests, the advantages, easy to use, relatively inexpensive. They can range from 400, at least for Project ARK, we can get them for as low as 450. I'll show you later the price is 600. No? Quick results. And IgG is a better measure of recovery than RT-PCR in some ways, no? Because sometimes you don't have the virus now, then you do again and you have it again, like Senator Angara. But again, a lot depends on the quality of the kit. I have to keep repeating that, because not all kits are the same. Again, disadvantages. A lot depends on the sensitivity and specificity of the test kit used. It cannot detect the infection before symptoms start. So unlike the PCR, it can. If you get the virus, even wala ka pang symptoms, you can detect it. And then IgM starts to rise after 3 to 5 days. It goes higher, and then it goes down after 2 weeks. Now, if you test too early, it might not be there yet. It might be too low to detect. Okay, so you have to know the advantages and disadvantages of both tests. And I really like to say they're complementary. They can help each other see the real picture. Because the nice thing about the IgG is that it can be used to determine also possible immunity, because it does have some immunity. We just don't know how much and how long. But it is a virus. It is a flu-like, it is a coronavirus. And the SARS-CoV-1 in 2003 did render immunity to its those who got it. No? But we don't know yet how long and how much, but there is. And the fact that you can donate your blood and your antibodies can actually help the sick get better shows that those IgG antibodies are really, really helpful, and they really fight the virus, okay? So let's go here. This is a graph that will help you understand, okay? This is the PCR, this is the virus. This is day 0, fever symptoms. No? Before the symptoms appear, you already can detect it, PCR. But as the days go by, after the 7th day, the chances of finding the virus in the nasal swab gets almost nil. Malabo na, no? That's why sometimes you can have false negatives. IgM, on the other hand, starts to rise only this time after you have the symptoms. Then it keeps rising. Then it goes down after the 14th day. No? Now, if you get your test in this area this time, in all likelihood, you will get it. Okay? But if you take it here, baka hindi. If you take it here, you won't get it. So you have to know, you can repeat the test after 7 days if you really think you have it. The IgG antibody, which is the one that lasts long, which could be the lifelong antibody in like measles, for example. No? Again, we don't know how long it will last. No? It comes out after it starts to be detectable, sometime mga 14th day, and it rises. And it's better to detect it on the 21st day after your symptoms. But sometimes we get people like in Tondo, in Sampaloc, who had both. So we got the medyo here. No? Both are detectable. No? So that means they had the virus, they're on their way to recovery already. So you have to know how to interpret. So it's not just simple as positive, negative. No. You never diagnose a test. You always diagnose a person. So it should come to, you should know, you should understand how this is done. You should also see the person. Are there symptoms? Are there no symptoms? So this is how these immunoglobulins and virus behave. No? And this is the basis of the tests. Just as a, wait, I want to just as a break, this is a video made by my husband. Now, when I made my video about coronavirus, this is the virus, so it was the ball of our dog that he just modified. This is a break. And I don't know if you can hear the music. This is Billie Eilish, Bad Guy, no? So, I don't know if you hear it, no? Wala? Okay, just as a break, no? So this is the virus. So he learned how to animate during the lockdown, a new skill. IgM comes in. Can't do anything. So then the IgG comes in.
So you're a tough guy. So sad, make you go sit with your dad type. I'm the bad guy.
Okay, so that's the IgG. They stay. No? They can stay forever. They can stay for 3 years. They render some immunity. So Billie Eilish. I would have. I want to show it in the World Wide Web, but I'll have to get permission. Who should be tested? Okay, you don't have to test everybody. No? Those who are asymptomatic or symptomatic persons who have been in close contact with confirmed COVID-19 persons. Okay, in the household, wife, boyfriend, no, etc., girlfriend. Asymptomatic or symptomatic persons who have been in close contact with probable COVID-19 persons. These are patients who have been swabbed but still waiting for results. If you've been in close contact with them, by all means be tested. All symptomatic persons, the symptoms I described earlier. No? Whether you have been in contact or not, if you show the symptoms of COVID-19, you have to be tested. Okay. Frontliners and essential workers, healthcare workers, those who have service-oriented jobs like hotel workers, waiters, policemen, firefighters, factory workers. It's because we're trying to also revive the economy. And these people will have to be facing people. No? And of course, high risk. Who are these people? Diabetics, hypertensives, immunosuppressed, those who are post-transplant, who are in immunosuppressives, cancer patients who are taking medicine, those grossly obese with a BMI of 41 or above, elderly and frail, chronic lung disease, renal disease. So all these people are considered high risk, and it would be better to test them. This is a very simple table rather, that some people wanted us to make. It's based on the Philippine College of Physicians template that we just added. No, if you have factory workers who come back, no. Oh, my internet is unstable. Can you hear me? No. Can you hear me? Okay. If you have people, no, let's see, no symptoms, no symptoms, no symptoms, no symptoms, and all you have is an antibody test. If they test positive for IgG, like that thing I showed you earlier, that lady, and then IgM negative, they may go back to work. Considered recovered, return to work. If they test positive for IgG and IgM, okay, this is a gray zone. Some say they're recovered and may go back to work, but we're rather conservative. We say, wait, then do another antibody test in 10 to 14 days. If IgM negative and IgG positive, then just may return to work. But some doctors say, no, as soon as your IgG is there, okay na yan. So we're still more conservative. plan to wait as long as there's IgM. If you're IgM positive, you are infected, and IgG negative, you have the active infection, we send them for swabbing, isolate for 14 days. Then we can repeat the RT-PCR after 14 days or repeat the antibody testing after 21 days. Again, if IgG positive and IgM negative, may go back to work, considered recovered. If they're both negative, you may either do a repeat antibody testing after 7 days, or you may want to swab to see if there's really something there. No? But if it's not available, you can just repeat the antibody test. No? If negative, return to work. Now, if they have symptoms, regardless of whether there's positive or negative, they should be considered infected, they should be isolated, sent for swabbing, and treat as you would an IgM positive. This is a very simple graph that sort of simplifies everything, okay? What about household health coming back from a long absence? You should test them. My driver came back yesterday. He was gone for the whole time of the quarantine, but I said, you come now because I need you to drive for me because I need to go to the hospital. I'm doing so many things for ARK. No? You test them. No? What are your choices? You can either do a PCR test if you can get it in good time. No? And then I would still do a rapid antibody test. No? This is if they come from a hotspot. No? The beauty about doing the barangay testing is that we can identify now which barangays, which cities are really hotspots and which are not. No? 94% of Manila, of Sampaloc, wala na pala. But Tondo might be a different thing. If your driver comes from Tondo and there's still a high incidence, I would definitely do a PCR test and a rapid antibody test as soon as he came back, before I even let him remove his mask or go inside the house. No? Or if PCR is not available, do a rapid antibody testing with a reliable brand, of course. No? And it will detect the infection in the first week onwards. And this may be missed by PCR. Because as I said, 70 to 80% of people with the infection are still asymptomatic or just mildly symptomatic. Parang sipon-sipon lang. It can be like that. How often should you test your workers? There is no hard and fast rule as yet because we are still in uncharted territories. This is a new virus. So everything I say today might not be true tomorrow. You know, antibody testing kits were so bad before, but they've improved and we have good ones like Roche, CTK Biotech, which I'll show you later. No? You may test them every 2 weeks thereafter with antibody tests, unless they suddenly develop symptoms. If they do, then test right away. Okay? I would lessen the frequency of days off because I think these are practical questions we all want to know. Like my health, for example, my driver, he used to go home every day. But now, since he came home, I told him, you can come back to work, but weekly na lang ang uwi mo. Weekly or every 2 weeks, if much as possible. Okay? Same thing with my household help, the helpers, the cook, the house girl, the household helper in the house. Sana every 2 weeks na lang ang uwi niyo. Not so often, or every 3 weeks. Because every time you go home and you come back, I will have to test you. Because I don't know where you've been. Okay? Because they both go home to their families. So instead of every week, it will have to be less often. So I think they will understand, no? Because we're not yet normal. We are gradually getting to normal. And so you have to always be aware, every time somebody enters your house who lives in another home, the possibility of bringing infection to your house is very real, okay? You can have them wear masks when they're in close contact with other people at home when they come back from their off days, because again, until they're tested again. Maybe a week after. So this is the reality of what we're living in. No, you have to remember that it's not going to be business as usual for a long time. Okay, we are testing a lot of rapid antibody test kits. No, I like CTK Biotech. It's made in the USA. It's more expensive than the others. This is personal, huh? But it has a very, very high sensitivity and specificity. Zhejiang Orient is actually HealGen in disguise. HealGen has also a very high sensitivity and specificity. And, but we can no longer get them in the Philippines because apparently we were told that the USA is getting all of them because HealGen is a US brand, US trademark made in China. So the same factory made Zhejiang Orient Gene, which is the same. If you look at it, it's the same. So we're still testing it. However, if it's the same as HealGen, then it should be good. So these two are good. Innovita, in the tests of Makati Med, they did some trials with various rapid anti-testing kits. They gave us the results. It was their #1 performer, okay? Even better than HealGen. Although in the US, if you look at their results, HealGen is better. So again, even these tests, even these validation tests are not all the same. But we are waiting for RITM and DOST to also do their validations, but we cannot wait for them to finish before we actually use them because we want to break ECQ by May 15. And the choice is to just let everybody go to work without testing or use something that's available. No? And the only thing we can advise is that you choose naman kits which have some sort of a acceptable level of accuracy. Zhuhai lives on, we're still testing. I cannot vouch for it, okay? Because we're still testing. Makati Med did not have it. Other hospitals don't have it. Kami pa lang. So I don't really know how it's going to perform. So I'm being very honest with you. We are looking into newly approved Roche COVID-19 antibody testing, which is like 99%, 98%. And I'm excited about this, and hopefully it will be available soon. There are also other Korean brands now and Canadian brands that we are planning to test. So we have time. It's not yet May 15. Hopefully we'll have them out. And if you are a member of ARK, or you can write to us, we can give you an update about these kits. No? I cannot speak about the PCR kits because I'm with Project ARK, but they're mostly, I think the Roche is a very good brand of PCR kits, but the different laboratories, many of them use the Chinese brand, the Sansure, which is okay, but I cannot speak about them, okay? Because as I told you earlier, it's not just a matter of the kit, it's so many things that come before the test is actually done, no? The human factors, no? The time element. So there's so many factors, no? That come into play. So should all of us be tested? Again, not necessarily. Right now, there's still a very long waiting period and there's a big backlog. The T3 project, this is the test, treat, and trace. This is with the private sector, I think San Miguel, I think ADB, Ayala, they're all part of this. They're helping the DOH. Their plan is to augment the PCR testing capacity of government, of our country, so that by May 30, we'll have 30,000 tests a day. And even more important than the testing is the results, not just the swabbing, but how fast you can get the results, okay? So hopefully 30,000 a day by end of May. But until that day comes, matagal. It's not fast, no, the results. Then until that day comes, their priority for PCR testing are returning OFWs, of which we have about 25,000 already. That's why they had to close the airport, because they cannot keep them all in the quarantine centers. We're filled. So they're doing this little by little. Their priority are healthcare workers, those with symptoms, and persons who will undergo elective or urgent surgery. Like what's happening in the hospital now, it's very difficult for us to go back to normal because our hospital is requiring all patients who will undergo surgery to have a swab test. And so, you know, it's a new normal even for the hospital. So we still are gingerly going back to normal, okay? So we need to think in terms of a new normal for a while until it ends, until this pandemic ends. How will it end? Physical distancing, antiviral medicines that we can use when we get sick, vaccine, and perhaps a herd immunity later on. Like what happened in the older times when so many people got sick and the ones who died, and the ones who survived became immune. No? But of course, we don't want that to happen. We don't want to kill off so many people, no? Especially those who aren't strong and the elderly. The last thing we want is a second or third or fourth wave that may be more devastating than the first. Same as remember what happened in the flu pandemic in 1918 to 1920. It was a very deadly influenza pandemic. There were four waves. The second wave was the deadliest. In the entirety of this pandemic, 500 million people were infected. Imagine, 1/3 of the population of the world at the time. The death toll estimated anywhere from 17 million to 50 million and possibly as high as 100 million. That's how bad this influenza pandemic was in 1918 to 1920. In the Philippines, 4 million were infected at that time and 80,000 deaths. We don't want to see that, okay? And most of the deaths and the infections came in the second wave. Why? This is World War I, no? And there was an armistice parade in Philadelphia in November 2018. A month before that, they already had 12,000 deaths, but they were so excited about so many things. There was no social distancing. And you see this crowd, no? And then they also had one in Trafalgar Square because of the armistice, so they were celebrating. Ayun, nangyari, there was a second wave, which was the deadliest wave, where most of the deaths and infections occurred. So let us not put our guard down, okay? We will have to live in terms of a new normal for a while until the pandemic ends. So after the ECQ, when we go into GCQ, we have to still wear our masks outside. No need to wear N95. Please reserve that for the doctors who are still taking care of patients. No? Practice physical distancing. Wash your hands frequently. This is like a very basic elementary, but wash your hands frequently. Don't touch your eyes, your nose, and your mouth, because this is the way by which the virus enters because of the mucous membranes. Disinfect your shoes when coming home. Avoid unnecessary trips. And work from home if you can. So these are just, just some common, practical tips for after the ECQ. So this is my second to the last slide, I think. No? Everyone, including our pets, our dog he really wants to get out of the house of the gate. He can't. We can't even walk our dogs. We can't even walk in the village. No? Everyone, including our pets, are eager to get our lives back to quote unquote normal. No? But God has pressed a reset button to everything. No? Parang we all have to be in reset. No? It was a good time to, not just to get closer to our families, to also re-examine our lives, no? To sort of slow down. No? We were forced to sort of reset. And for me, as a Catholic and a Christian, I always look at this phrase or this from Isaiah. No? The Lord is trying us in the furnace of affliction. Okay? But by faith, by caring for each other and foregoing selfishness, we will come out of this as gold. So there's hope, no? And we are gradually coming out of this. And but we have to do it the right way, not just emotionally, spiritually, physically, mentally, intellectually. So with that, I'd like to say thank you very much. I'm done. No? Stop share. Okay. I can't. I have to bring this up.
Thank you so much, Minguita. We're gonna start the question and answer portion. I have two questions first that were texted. You can actually put your questions in the chat. Otherwise, you can raise your hands and I'll unmute your mic. I have a question. Sorry.
I hope they're not too difficult. Anyway,
okay. One question from Cara Wilson. If the rapid test cannot detect the virus before symptoms start, then for the majority of us who are asymptomatic, is it not recommended?
If you have been in quarantine and you are not symptomatic, then the likelihood of you even having the disease is very low. If you have been in quarantine, rather. Because the reason we were in a 2-month quarantine is so if there's anybody sick, it will come out na. Okay, you got it. If you got sick, you would have gotten sick unless you were going out to all these places. But that's why I said, if you want to detect for sure something before it comes out, then send them for a rapid for a RT-PCR, maybe in a Red Cross, no? But do you have to all do that? No, I'm not going to do it because I know I didn't get sick, you know. I was good. I didn't go out. My mother refuses to be tested because she goes, I'm just at home. I don't have to be tested. So do you have to be tested? No, but if you want to be tested and you want to make sure that it's not, you can catch the virus before you get the symptoms, then by all means do a PCR. However, again, I tell you, if you had it already, if you're on your second week, okay, after 7 days, you will not catch it anymore, most likely. That's why I said maybe both. If you have the money, do both. The PCR kit, the rapid antibody test is very inexpensive. The PCR, you can do it. It's about 3,500 in Red Cross, no? But I don't know if they'll do it. I hope they do because they're still prioritizing the symptomatics, okay? Healthcare workers, the OFWs. But I'm sure naman if you ask, siguro you can do it. Now, St. Luke's can do it. St. Luke's can do it. but I don't know their policy now on who they'll do it on. But certainly, if you want to be absolutely certain, I would do both. If I'm really obsy, okay? Now, there was a, because nga, one will detect it before you even get symptoms, mga 2 days before, but it will disappear after the 7th day. The other one naman can detect it from 3 days up to for a long, long time, no? Depending also on the sensitivity of the kit you use, okay? So that's my answer. No? Depends.
Okay. I have another question from Chiqui Quintos. Chiqui, I'm gonna unmute your mic. Chiqui, can we hear you? Oh, there. Oops.
There, okay. Hi, Minguita. Thank you for that discussion. It was very informative. I think this is a question that a lot of us might be struggling with right now because we've had our helpers be in quarantine for like 2 months.
Yes, yes.
Many of whom have families.
Yes.
So after this quarantine, they might be wanting to go home.
Exactly. I saw that. They want to go home. They'll go on off days, isn't it?
Right. And let's say they come back. It's day 1. You are recommending they wear masks until they can become.
Yes, I also recommend they be tested every 2
Yeah,
weeks.
right. But you would test. Let's say they come back on day 1, and you would test them on day 5,
5 or 7.
5 or 7. And who can administer this test? Because it's a drawing of blood, right? And
No,
that's
yeah,
not.
okay. Yeah, okay. You don't have to draw blood all the time. We test our kits using 2 ways. Venipuncture, getting blood from the antecubital vein, and also by finger prick. So we're seeing whether a lot of the tests like the HealGen, you can use a finger prick blood, okay? So, but if you want to draw blood, you have to bring them to the hospital, okay, to the lab to do it for you. If you want to do the finger prick, the rule is, okay, based on FDA, there has to be a physician who is at least supervising. Okay, supervising is a word that you can interpret in many ways.
Right.
You can ask a nurse from the barangay to do it, and then ask a doctor to interpret it. Okay?
Right.
So it can be done in the barangay. You have a barangay office, like wherever it is you live in. Like in Sano, they can bring them to the barangay because I'm training our barangay doctors and nurses to do this.
So you would test on day 7. You should get the results in 15 minutes, right?
Yes.
And then in that 7-day period, they should be wearing a mask at home, basically.
I would do that. I mean, again, this is my suggestion of many doctors. It's not a hard and fast rule. You may not want to do it, but logically speaking, you don't know where they've come from.
Right.
Treat them as though they're potentially infected. Unfortunately, it's going to be like that.
And then you should continue to do that, I guess, until, every time they go on a day off.
So I was suggesting 2 weeks. 2 weeks, before you go on a day off. Then come back, then test after a week. Then after a week, you can go off again. Things like that.
Yeah.
Because especially if they come from a place that's very, you don't know. You have to know also how. In fact, we can do testing in the place where they live. But then again, it's going to be like that. We have to be a little paranoid until we're sure that we have a vaccine or there's herd immunity, etc., etc.
So one more question. How available are these rapid tests now? Because we're coming close to May 15, right?
Right. So what ARK is, I wish Jupin were here. Some of them are already here. I know Innovita is here. CTK Biotech was supposed to have arrived today, okay? So we can check. They promised to be able to bring it in today unless there was a problem with the airplane. Then the others, the Livson is available, but I cannot vouch for it as yet because I don't know how it performs. No? Zhejiang Orient Gene is available. It's like HealGen. But I want to warn everyone, no, because a lot of the results also depend on how you handle the kits. You should never store them above 30 degrees centigrade, and it's very hot nowadays. Better to refrigerate them because otherwise they will just denature, and then the reagents will not be working well, and you won't get good results. No, so even if the kit is supposed to be okay, you might get really bad results, or you might get invalid results all the time. It's probably heat damaged, and many people don't know that. Same for the PCR kits. You have to really take care of them temperature wise.
And where I mean, I guess I can get them through you, but would they be?
I don't sell kits. You know who you should call? You should contact Japine Romero of ARK.
Okay, all right.
Because she's and I can leave. Okay, Bambina, I can leave with you that slide I showed.
Yes. And then we'll email it to all the participants who are interested.
Yeah,
Thank
because
you.
the numbers of the distributors are there. So I don't sell kits, no. So we just.
Thank you. Thank you.
Okay, just corollary to that, I have a question from Bonnie Santos. So, with regard to helpers, is it okay to leave them to let them return and wait 5 to 7 days to test? And then if they're in your home during those periods, what if you have live out help?
If you have live out help who come back and forth every day, I wouldn't suggest it, because you don't have control. Yeah. Because like my driver, he's a stay out. He goes home every day. But for this period, I told him, I'm going to get you back to work, but you have to go home only weekly, not every day like before. Hindi pwede, because it's going to be more difficult and more dangerous until such a time that we're out of this danger. No, then you cannot be in and out every day, because you don't know where they're going. You don't know if they ride the MRT, for example, they ride the bus, although there's physical distancing, it's still difficult. You might touch surfaces, you might touch your eyes, you don't know.
But how often do you have to test them if they keep, like if they go every week or every 2 weeks?
Every 2 weeks, we said, okay, I would suggest every 2 weeks, no? Because then you can test them the week after they arrive. Okay. Because like, for example, depends how long they're gone. Most are gone like 2 nights, or 2 nights, maybe they stay home with their family, or overnight, I don't know. No, then they'll come back maybe a Monday, and then you can test them on a Friday or a Saturday, and then okay na sila the rest of the time, fine. But then after that, they go out again. That's one, no. But others naman will say, wag muna kayo umuwi. It's so cruel naman, because they're dying to see their families, no. So it's difficult, because there's again no hard and fast rule. That every 2 weeks was a suggestion of an epidemiologist and infectious disease specialist. Okay, that would be the logical way to do it. Okay, not naman every day like they do in Malacanang. There's a time they're testing everybody every day. When you come in, you come out, they're testing you, which doesn't make sense. There's a mapping. Somebody I saw there. Is there a mapping?
Yeah,
a mapping.
Is there mapping of the area where the helper comes from?
Yes, that's a very good question. In fact, that's what we want to do for Project ARK, is to map the area. That's what we're doing now in Manila. See, if the LGU, the mayor works with us, we are able to map the area. So now we know Sampaloc, we know Tondo, we know 94% of the people tested were negative for anything. So then the rest we were able to isolate. No? So at least it gives you an idea that it's kind of safe na there. In fact, they were able to start commerce again. Tondo, we haven't gotten the results yet, but there are more people positive in Tondo. Okay. Now, if your family, if your household helpers, like I have one who lives in San Rafael, Bulacan, which is in Nueva Ecija, near Nueva Ecija. Na, I am really certain. I hope that their LGU will test them, no, and that they will test them with proper kits. So. Again, this is hard, because this is one thing I'm going to suggest to ARK, is that we partner naman with the League of Governors, League of Mayors, to educate them as to how to do it. No? Because they're being fooled. Many of them are being sold expensive kits, which are really bad. No? They don't know any better. Kawawa naman. So yes, mapping is ideal, like what New York is doing. See, Governor Cuomo is mapping New York, which should really be the case. We should map them but again, a lot depends on the kit.
And then, going back, everybody seems to be concerned about their helpers, because
yes, it is a concern. It's really a concern.
They can start coming in. Now, if you say they can go, take their day off or whatever, go off every other week or something, the 5 to 7 days in your house.
Before they're tested.
Or while they're working in your house before they're tested, how I guess you have to wear masks.
Yes, they have to wear masks with you, and you have to wear masks with them. I mean, because they're like they're like again coming from outside. Eh. They're coming from a place that you have no control over, di ba?
Yeah.
And until such a time, like just like workers in a factory now or workers in an office, you see each other every day. You still have to wear masks now because you're all coming from different homes, no? Unlike if you're in the same place quarantined, then you don't. But henceforth, that's why it's a very difficult thing about dilemma for household helpers, no? Because we love them, they're part of the family, and yet, if they're gonna go off to their families, when they come back, you have to treat them as though they're potentially infected. Diba? You have to be a little paranoid. They should clean their shoes, disinfect them, perhaps change before they enter the house, change clothes downstairs before they, or whatever, before they the entrance. Maybe have a system like that. No, in our house, our knobs are always cleaned with Clorox solution. No, okay, 1:9 solution in the morning and the evening, and then all places that are touched. No, and right now, of course, none of us wears masks because we've been quarantined together for 2 months. No, but after they leave, iba na yan because they can pick up the virus outside. So it's a danger. It's not yet we are still not yet safe. So we have to think a little paranoid. Yeah. And maybe talk to your help as well. Like I had to, like when this started, I told my help, none of you can, either you go home and stay home or you stay here and not go home. So they stayed here with us. But anyway, now they're dying to see their relatives, their families.
Yeah. Okay, let's go from household to office.
Okay.
Question from Pinky Tobiano. If
Okay.
you make a rapid test area in COVID rapid test area in your office and suddenly one employee tests positive,
Yes.
what's the protocol for this?
Okay.
As well as the person conducting the test, the employee, and the area that was used for testing.
Okay. You must have an area isolated, no? For your testing area. Now, I know because when they come back, no? I know many are testing or even will test before. Like Solaris tested 4,000 employees, no? 2,000 employees and 2,000 contractuals, no? And they got a place, an open air place, not inside the hotel. No? So you can get like a garage or something open space, okay, to test. No? The people doing the test, I can share with you our protocol, no, must wear PPEs. They have to wear the protection, the mask, the N95, the gown, the cap, etc., gloves. No, now if somebody tests positive, there should be an isolation room. Okay, they are IgM positive, no, isolation room. Or if they have fever when they come in, no, you put them aside first. Don't let them enter the office itself. You must have a place where they can be isolated. No? Then if they test positive for IgM or if they show any symptoms of coronavirus, then you must isolate them, quarantine them. If they can be quarantined at home, yes. But send them for a PCR testing, just for confirmatory, if it's available, because some places it's not available, diba? So treat them as though they were COVID-19 positive. If they're mildly symptomatic or asymptomatic, they can just stay at home, no? Or in a quarantine area. Some cities have quarantine zones already, some quarantine buildings, no? Now, if they're moderately symptomatic, they're having difficulty breathing, then you have to send them to a COVID center, no? Okay, because but definitely you have to have a place to test, no? You can use the clinic for muna, no? Then if somebody tests positive, you should disinfect. In the hospital now, we're disinfecting almost every day in our clinics, no? And after every patient, we alcoholize and, ganun talaga ngayon. No? So definitely you need a place. Now, DOLE, Department of Labor and Employment, came out with guidelines already. I think you can get hold of it and maybe give it to your members because I can send it to you, Bambina, the DOLE memorandum. It's a very detailed guideline of how to start and what to do, no? And then how to even eat, it's all there, how the canteen should be set up, in the beginning. And their advice is like half of the workforce muna, not right away. So you may have to also adjust the workforce in the beginning. So the DOLE guidelines memo I'll send to you as well. I'll WhatsApp it to you, then you can share it with the members.
Okay,
Thank
so
you.
I just want to point out with these DOLE guidelines, maybe I have someone who's asking for the construction industry. We
Yes.
have people who are left stranded at their camp since the start of ECQ up to now, and they are seriously checking and monitoring their health. On the other hand, they have people who have managed to go home and will come once we resume work. What test can be most feasible to that setup, if required by the Department of Public Works and Highways, to test all our manpower, both those who are left at camp and those who went home?
It is not required. Okay, it is not required. In fact, it tells you don't have to test them. However, if anyone is symptomatic, they should be tested. Okay, with ideally symptomatic, do a PCR. We're just being extremely careful. No? Those who were coming back for the first time, if they quarantine and they're asymptomatic and nobody got sick in their households, then in all likelihood they're not sick. Okay, I want to make it clear. Testing is not required by government. It's not, okay? Except that if somebody becomes symptomatic, you'll see in the DOLE guidelines, they must be tested. And their recommendation for symptomatics is the PCR, okay? Now, if you do not have access to a PCR right away, you can do the rapid antibody testing because again, it's not as accessible. Hopefully it is. Sana, it's accessible and we can go to any corner and have ourselves tested. Also, the results may take a while. No? So you can get the good antibody tests, okay? But if you're symptomatic, treat as COVID unless proven otherwise. Isolate, quarantine. So again, government does not require you to test. It is not a law, but you may want to do it for your own peace of mind, you know, and safety. Now, another question, what if they're doing construction in your village, for example? What do you do? Is it better for them to just stay there in the construction site rather than keep going out back and forth, diba? So these are the questions the barangay has to also decide. Like, it might be better to quarantine them in a place in the construction site muna. You know, build a small air-conditioned place instead of having them go back and forth every day. That's more dangerous. So these are questions we have to solve and we have to decide with the barangay also, the villages. Because there will be constructions in the village.
Now, for testing in the office, this is from Katrina Abenohar. Can you send the test to individuals to do the test at home? I'm assuming this is a rapid test kit before they come to work. Or it's better to have a set up
in the office. Yeah, because at least you see, okay, it's not if you're a member of ARK, for example, you use our protocol. I really suggest you do because it will put some sense into what we're doing. It's not just testing. It's who you test, how you test, you know. Some said test everybody. Some said, no, you don't have to test everybody. You can make it targeted. So you can decide based on the protocol. The nice thing about doing it with a system is that the patient data, the form, no, you can actually even send it to us, no, and it will be part of the DOH data. We have a data sheet. We have everything. We can help you. How do you now record your data? What's significant? What's not significant? Of course, you can do it at home, but again, I'm not supposed to tell you this because the FDA says it should be under the supervision, at least of a physician. So companies have physicians. The nurse can do it. The medtech can do it. You can do it, no? But it's not as easy as a sugar test because the sugar test, you just prick yourself and you just sort of put it against the paper. You know, this one is not it because you have to get more blood than that. Okay, medyo substantial, mga at least 2 full drops of blood, no? Sometimes 4, if there are 2 wells. No? So it might not be as easy as you think. So I would still suggest better talaga to have it in a system before you all come to work. No? Okay. Anything else? What time is it?
Well, we still have a bit more time. Hang on a second. Oh, someone said with regard to the construction industry, apparently the Department of Public Works and Highways has issued Department Order 35 Series 2020 requiring all workers to be tested with any available COVID tests. So,
okay. See, I didn't know that. The only thing I got was the DOLE, no, for factory workers, etc., but not for construction workers. Yeah. So,
And then
It's
how many times can you donate if you're a COVID patient? How many times is from Pinky Tobiano again? How many
okay,
times can you donate blood?
every 2 weeks. So you have to first recover, and then you should be asymptomatic and recovered for at least 21 days, no? And then you can donate every 2 weeks, but only for a maximum of 12 per year. So that's how it is. And they get your plasma. Okay, PGH, I know, and St. Luke's are doing this, no? But PGH is more open-minded in the sense that they accept even people who never had a PCR test or who tested PCR negative but tested IgG positive. A lot of doctors, my colleagues, no, we had so many who got infected actually, in ophthalmology, so many, and they never got tested, no. And there were 2 who got tested, but late in the game, 11th day na, they went for testing, and then their PCR was negative. But then they were certain they had COVID because of their symptoms, no. One of them lost her sense of smell, that she kept putting lemon down in the food, and her son said, "Why is it like that?" She couldn't smell, no? And she got weak. She had diarrhea for 1 day, so she had these symptoms. Anyway, she came to the house. She got hawa. She was exposed March 8th, same as that other lady in whose test I showed, no. Then she came to the house, and then mga April 20s, no. So it was more than 21 days since her symptoms. And then she tested positive for IgG. And mabuti na lang, it's good that PGH, and we're all from PGH, accepted her as a potential donor, even if she never tested with PCR. Some will not accept you unless you had tested positive with PCR. So what they did is they saw her IgG. This is immunoglobulin G with a very good test, with a good sensitivity and specificity. So they screened her, and sure enough, she was able to donate. So she's happy. So you can go to PGH if it's just if you never had a PCR before, then, and you only have your IgG, because many nga are asymptomatic, they were never tested, no? Or there's just very mildly symptomatic. Then you can go to PGH and they'll still consider you for donation, okay? But they won't consider you for donation in St. Luke's, because they're still using the PCR test, yun lang, as a basis, okay? So that, every 2 weeks, at the most 12 times a year.
Okay, let's see. Well, we have another question about the government, what governments are going to ask businesses to do with their employees, but I guess that's covered with
Dole and the construction, yes.
But when you have salespeople who need to have contact with customers, what the least you can do, I guess, is the mask and the social distancing and the alcohol.
That's the least, yeah. The least you can do is that, no? That's why many people who are in the service industry, who are in the restaurant industry, who are in the service delivery industry, they're having their employees tested by the antibody testing at least, no? And they're planning to do it every 2 weeks, okay? Unless the person is symptomatic, okay?
You don't recommend everyday testing, right?
It doesn't make sense. It doesn't make sense because if it's as I showed you the curve, if you don't see it now, wait a while. You probably won't see it tomorrow, but it will go up, no? But then if you're symptomatic, test right away. If you're asymptomatic, then test every 2 weeks. You'll get something. If there really is something there. Okay. But then again, in the workforce, you have to still wear a mask. If you're service delivery, if you're tellers, if you're clerks, if you're what they call this customer relations people. But Bambina, the recommendation also is, as much as possible, if you can, work from home and do virtual consultation, virtual stuff, because the less contact you have with people, muna, the better. Restaurants is another thing. Restaurants, their waiters have to be tested, because it might make you feel better to see like a label. That's what ARK is planning to do. This place tests their workers regularly, parang ganyan, no? So you kind of feel more at ease going to a place that tests, than a restaurant, for example, than one that doesn't test, no? So things like that, especially mga service, eating places, stuff like that.
But if you've taken the rapid antibody test, this is again from Bonnie Santos, and you have a positive IgG, are you immune and safe enough to go around?
Okay, that's a good question. If you have a positive IgG, you have immunity. You have, okay? However, like the WHO, they're still very careful. how much immunity? Is it total immunity? Is it partial immunity? And how long will it last? We still don't know because it's a new virus. But you do have immunity because the fact that you can donate your blood to help people fight the disease means your IgG is there to fight the disease. In the cartoon kanina, it's the immunoglobulin that stays with you. No? Now, some viruses like measles virus, you have lifelong immunity, but some you don't. No? So we still don't know. The SARS, the old SARS-CoV virus, because COVID is SARS-CoV-2. The SARS-CoV-1, it had about 2-3 years immunity. So okay na yan, because by the time you'll have a vaccine, no? Hopefully. So you have, but we always tell people, don't think that you're invincible. Okay? You still have to, the best thing to do is to still wear your mask, still act as though you can get it. But in your mind, you already know you're a little safer. You're safer than most, okay? Because you have the IgG. Again, we have to qualify. In the States, in fact, they're saying they believe there'll be a second wave in the winter because of the cold. And they're saying now we can test all our IgGs. We can make them, sa sabak natin, we'll make them the frontliners and see what happens to them. It's like a living experiment. See how well they do. Because many of these IgG people before, if you expose them to the virus again, either they don't get it or they get it very mildly because they have some protection already. Okay, but still we cannot do without our mask, our physical distancing. Still better to be like that. Okay, to be sure.
And if we wear a cloth mask, do we need to put like a tissue or something?
Better, yeah.
Better.
Cloth mask, yeah. So it's more filter. If you're wearing a regular surgical mask, you don't have to. It's enough. You don't have to wear an N95 for going around. Okay, a surgical mask is enough, or a cloth mask with some tissue inside. Better for the filtering.
Okay. I think there's another question. Okay.
Flu season is approaching.
Do we still get a flu shot with the flu season approaching?
The flu shot is helpful in the sense that sometimes, okay, if you're, especially if you're elderly, the older people, you have comorbidities, the flu shot, because some people will be okay na from the coronavirus, then they get secondary infections. They can get pneumonia again, secondary infections from different kinds of diseases. So it's not going to protect you against coronavirus 2. It's not going to protect you against nCoV-2, which is caused with the cause of COVID, but it can protect you from other things. Pneumonia, the pneumonia vaccine can help against pneumonia, a community-acquired pneumonia, which is bacterial. So it can help you avoid other infections. Okay, so you can still have it. It's different from this. Okay? It's different from this.
There's another question here. Do you have some standard contact tracing methods for the private sector if employees come up COVID positive?
Definitely. If they come back, you have to trace their contacts, their family, who they were in close contact with for the last 14 days. Or usually the symptoms are within 6 days. Okay, they're infectious. And they're infectious about a couple of days before they're symptomatic, 3 days before they're symptomatic. So you can trace, you can use it for tracing. Definitely you have to contact trace. And I think you can ask the DOH to help you with that, or you can ask, the PNP, they're helping with that actually. Because you have to report all COVID positive patients, they have to report to the DOH, it's mandatory. And they can help you with the contact tracing. They hired people just for that. Contact tracing. But please be honest. We should remove the stigma from COVID. They have to be honest, because this is not a sexually transmitted disease. You didn't do anything wrong to get COVID. Because if it's HIV, sometimes you understand, but or else syphilis or gonorrhea, then they really don't want to tell you. But it's COVID-19. It's not. We don't even know you have it many times. So please be honest, and let's not stigmatize them naman also. Okay, let's just treat it as another viral disease, infection. It has to be reported, though.
In your opinion, do you think we're ready to open by May 15? After May 15?
No, I think we are already, because we've been in lockdown for so long, And the curve is really flattening, okay? So, but it doesn't mean that it's gone totally. But it's much, 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 much less. So we're ready, but we need to have a different normal. No? We can never let our guards down. We still have to use the masks. We still have to do physical distancing. We cannot go back to just being careless, no, and foolhardy and everything. But we can. But even offices, they're recommending talagang start with a skeletal force muna, or just 50%, or go on shifts if you can, things like that. It cannot be full blast immediately. Even the malls cannot be full blast immediately. It'll have to be gradual until we see, meron ba, wala ba, how are we doing? Then we have to monitor. Is that going up again, the infection, or is it not? No? So there has to be vigilance. No? Vigilance.
Yeah. Okay, and then Cara has another question. If there's a second surge, let's say 2 weeks after reopening, how prepared how much has the health system capacity been improved to be ready for it?
I'm not from DOH. I don't know. Because I'm hoping that because of, right now we're not prepared based on the testing capacity. If there's a surge again, we really have to do mass testing. If there's rapid PCR, that's the best. Rapid PCR, that you can get it immediately. No? And talagang drive in or whatever. Now, the private sector is helping. Diba? They're helping to put up mga swabbing stations and everything. But it's one thing to swab. It's one thing to get the test results. You can swab and swab all you want, but then if your results come out a week after or 2 weeks after because there's no reagent or there's no machine or that's what I'm afraid of. Okay, definitely the curve has flattened. Our hospitals are no longer in distress. We're not anymore. I'll just put my we're not anymore in a crisis situation in the hospitals. Everything is more relaxed. Okay, we will know right away if it's getting bad again because people will start coming again. No, the hospitals are a very good gauge of that. No? Then as soon as that happens, we'll go on lockdown again. We probably have to go on lockdown again. So it will have to happen again. Hopefully it doesn't happen. We have to pray, but we have to be good. We cannot abuse our freedom. We cannot expect normalcy yet. Okay, we have to pray a lot. So, the government hospitals are not yet ready. I'm telling you. PGH is, certain hospitals are, the COVID centers are. We have a lot of ventilators, but we have to, and ventilators that are not that necessary naman right away, And we are lucky that this disease, many of them are mild, unless it mutates. Hopefully it doesn't mutate to something else. And that's really hard. If it mutates and it's even worse, then that's difficult. So are we prepared? As we are now, no. Hopefully in 2 weeks' time, we will be.
And provincial hospitals also, no? They're not.
Which one?
Some provincial hospitals are not equipped.
No, they're not. They're not equipped. So, like what's happening now, Manila, mukhang we're on our way down, no? But Zamboanga, Cebu, other provinces, they're just starting to go up. They're just starting to get their surges. So they have to learn from us. They have to learn from our mistakes. They have to be more prepared. So I hope we use this pandemic as a means to prepare for whatever comes in the future. No? Like, Bambina, we have so many gene expert machines. Gene expert machines are the machines we use to diagnose tuberculosis. And we have so much TB in the Philippines. These gene expert machines can just need a cassette that can diagnose COVID-19. Mm-hmm. Just change the cassette, okay? We should now stock up on those cassettes, not just in case. We cannot wait for a time to come that's again there that we'll start scampering for cassettes. No? We're ordering them, but we're also competing with the world. And this is easier because we have about 400 plus machines scattered around the country. See? So we could use them, even in the provinces, even in the barangay, the city halls, they have them in their city clinics. Because TB is all over the country. And we have these gene expert machines. No? We just need the cassettes. Well, DOH ordered some cassettes already, but siguro we have to stock up on these. It's less expensive. Okay? And it can be done. So everybody can do it. Mga ganyan, strategies like that should be done. Even now, prepared for it. No? So
There was something in the New York Times a couple of weeks ago about BCG, the TB.
Yeah,
Have at birth. We here have to tend to have at birth in Asia.
yes. I mean, we have a, what even worse, no, that it can be protective now, the BCG
Yeah.
vaccine.
Yeah.
Protective.
I don't know. Oh, is that borne out by any empirical?
Actually, there are studies that are showing it's possible. There's a lot of theories. So I said, maybe that's why the Filipinos, if we have their BCG vaccines, then we're okay, di ba? Because TB is endemic here, so we all get BCG. So maybe TB is saving us also, the TB and then endemicity of TB. So these are theories. No? Some say the polio vaccine can also help because it's a virus. So there are many while waiting for the vaccine. But another thing they're planning to do is the antibodies again, the IgG, instead of just the plasma therapy, they're planning to sort of hyper immunotherapy, parang siksik, put it together and then just use it as a temporary immunity, like it's called passive immunity, while waiting for the vaccine. Inject it into you and give you antibodies already. That's another possibility. It gives you like 30 days immunity, mga ganon, no? While waiting for the vaccine. So then we have, of course, the Avigan, no? Some antiviral medicines which are experimental but which seem to be working. So there, it's just a very new virus.
Yeah.
Not even a year old.
Yeah, I think one more question. Does anyone have one more question? Because I think we've taken a lot of Dr. Padilla's time.
Okay, I enjoyed it, but
For spending the afternoon with us. Really happy to see a lot of members logged on and joining this chat. And I hope we've been able to answer a lot of your questions.
I hope I helped you in a way. No? But Bambina, I want to stress, there's so much we don't know about this virus. It's new. So everything I'm telling you is what we know today. Okay, tomorrow it will be different. No, so who knows? There might be something else next week. No, so but I think the basic recommendations for what I said, what we do after the ECQ, how to keep safe, those will remain until we have a vaccine.
Okay. So stay tuned, stay safe, wear a mask, sanitize. I guess all the basic things we've
been
learned
doing
to live with the last few months.
Work at home if possible. Work at home if possible. Work from home if possible.
Okay. Thank you so much, Dr. Minguita. That was great. Thank you for spending your afternoon with us, everyone. And please send us your maybe your emails if you want to receive more information about Project ARK and the tests that are available.
Yeah, we'll let you know. Huh? And if there's anything new, we'll let you know. Okay, bye-bye. Thank you. Thank you. My pleasure to be with you.
Thanks, Minguita.
Bye-bye.
Just gonna answer. Okay. Thanks, everyone.